Picture this, you're 62 years old, it's been years since your last period. Menopause is behind you. Then one morning, you woke up and found blood stain in your underwear. Your first thought might be, that's strange. Maybe you brushed it off. Maybe you think, I'll mention it at my next doctor's appointment. But here's what you need to know. This is a medical emergency that requires immediate evaluation. Today, we're talking about something that affects thousands of women, and it is postmenopausal bleeding. By the end of this video, you will know exactly what it is, why it happens, and most importantly, what to do about it. So what is postmenopausal bleeding? Let's start with the basics. Postmenopausal bleeding is any uterine bleeding, staining, or spotting that occurs after menopause. So then, what is menopause? Menopause is defined as 1 full year without any bleeding. Not 6 months, not 9 months, 1 full year. So if it's been a year or more since your last period and you experience any bleeding at all, even just a spot on your underwear or a brown discharge, that is postmenopausal bleeding. This includes everything from light spotting to heavy bleeding with clots. It doesn't matter. And here's an important note. If you're using low-dose local vaginal estrogen and you experience bleeding, you still need to be evaluated. The estrogen does not explain away the bleeding. If you're questioning if you're the only one dealing with postmenopausal bleeding, the answer is no. Postmenopausal bleeding occurs in about 4 to 11% of women. That means if you gathered 100 postmenopausal women in a room, somewhere between 4 to 11 of them will experience some form of vaginal bleeding. That's more common than you might think. But here's where things get concerning. A study of 145 postmenopausal women revealed some alarming gaps in knowledge. 37% didn't realize that bleeding after menopause can be a sign of uterine cancer. 41% said that if they had just one episode of bleeding, they wouldn't even call their healthcare provider. And 47% didn't know that menopause is officially 1 full year without any bleeding. This number shows us that patient education is still lacking, and that's exactly why we're having this conversation today. Symptoms of postmenopausal bleeding are actually quite straightforward. You might see blood on toilet paper when you wipe, pink or brown discharge on your underwear, light spotting, heavier bleeding similar to periods, blood clots. Some women notice it first thing in the morning. Others might see it throughout the day. The timing doesn't matter as much as the fact that it's happening at all. Now let's talk about the cause of PMB, because this is where things get serious. In the medical field, we have a golden rule. All postmenopausal uterine bleeding must be treated as cancer until proven otherwise. I want to be very clear. This does not mean that every woman with postmenopausal bleeding has cancer. In fact, most women with these symptoms do not have cancer. But because cancer is one of the possible causes and catching it early can be life-saving, we must rule it out first. Research published in the American Journal of Obstetrics and Gynecology shows something remarkable. Patients who received treatment within 8 weeks of their first bleeding episode had survival rates and outcomes that were just as good as patients whose cancers were found before they even had any symptoms. So I want to emphasize this again. Acting within 8 weeks gives you the same excellent prognosis as catching it before bleeding even starts. So what are other possible causes of PMB apart from uterine cancer? There are actually quite a few. Vaginal and uterine atrophy, uterine polyps, fibroids, hyperplasia or thickening of the uterine lining, adenomyosis, trauma or prolapse. The only way to know which of these is causing your bleeding is to get evaluated by a healthcare provider. So what happens when you report postmenopausal bleeding to your doctor? First, don't wait. This is not something to mention at your annual checkup 6 months from now. Call your healthcare provider as soon as you notice any bleeding. Most doctors will want to see you quickly, often within a few days. Your evaluation will likely include a detailed medical history, a physical examination including a pelvic exam, an ultrasound, an endometrial biopsy. Sometimes additional tests are needed like hysteroscopy. The treatment depends entirely on the cause of the vaginal bleeding. The bottom line? Early evaluation leads to early diagnosis, which leads to better outcomes, no matter what the cause turns out to be. Let me share something empowering with you. Knowledge is your superpower here. Now that you know that any bleeding after 1 year without a period is not normal, you're equipped to advocate for yourself. You know that one episode of bleeding is enough to warrant a call to your doctor. You know that waiting is not the answer. If you experience postmenopausal bleeding, don't panic, but don't wait. Call your healthcare provider right away. Be specific. Tell them it's postmenopausal bleeding and that you need to be evaluated soon. Keep track. Note when the bleeding started, how much, and what it looks like. And here's something else. Share this information. Talk to your mother, your sisters, your friends who are approaching or past menopause. You have the power to potentially save a life simply by sharing what you've learned today. If this video has helped you, please give us a like, leave a comment, and also don't forget to subscribe for more menopause tips you can actually use.